Warning, censorship. Warning, censorship.
And then there's, of course, the famous swab that now they're saying we're going to test newborn babies within 24 hours. If you give birth and you've tested positive or you're suspected positive for COVID-19, then we will take your little baby just born and stick a swab up their nose.
For Rebel News, I'm Tamara Ugolini, and I'm joined here with Kate Wand, who
Hello.
has done extensive research into the current unfoldings in Ontario hospitals regarding maternity care, maternity and neonatal care. What Kate has found seems to complement nicely some of the interviews I've conducted with neonatal intensive care nurse Kristen Nagel, who has denounced many of these policies and implementations as avoiding or completely disregarding ethics in the hospital setting. So Kate Wand has written an essay titled Obstetrical Violence. And maybe we can start there, Kate, with what happened to prompt you to write this essay and the key points that you hit within this writing.
Right. So I actually wrote this essay basically because I had done some of the research into what was happening in my local hospital after hearing some kind of scary anecdotes through the grapevine of people who had given birth during the COVID pandemic. So I called up my local hospital and I said, hey, what are you guys doing? What's your policies around COVID-19 in the labor and maternity ward? And I was just kind of horrified by what they had said. Things like masking during labor. If mothers were suspected to have COVID-19, that their babies would also be tested with nasal swabs and things like that. So that was really concerning for me. So I actually ended up doing some research and finding out that this is not just a local problem, but it's a problem within our province, within our country, and within the whole world. And so I wrote an essay, Obstetrical Violence, which drew stories from women in New York, in France, in Canada, and I juxtaposed it with the Ontario Ministry of Health guidelines, which are showing that these policies are actually equating to institutionalized abuses in the maternity and labor ward. And I wanted to see what I could do about shedding some light onto that.
Mm-hmm. And this, of course, is obviously an issue that hits home for you.
Yes.
Both of us, as we prepare for the delivery of babies. I hope you don't mind me saying this on camera, Kate, but this is your first baby. So
Yes.
Already there's a lot of uncertainty and hesitation, anxiety going into unfamiliar territory. How has what you've seen here in these policies, how has that compounded your feelings as a first-time mom?
Well, already it's been a difficult year because nothing has been normal. And, you know, even for example, like my husband wasn't able to come in for the first ultrasound. So the first experience that you have of really connecting with your baby inside of you before you can even feel him moving, that just shows that he's there and you can see him and you can hear his heartbeat. And, you know, I had to go into an empty hospital, might I say, in a mask, into the basement by myself with my husband sitting in the car over FaceTime while I'm, you know, experiencing this and I'm sobbing tears of joy and he's crying in the car. And so from the get-go, it was clear that it wasn't going to be something that was normal. And so there's obviously also lack of a support system. There's, you know, neonatal courses and all of these kinds of things that would normally prepare you, like what you have in your head of, okay, well, I can take parenting courses and I can take labor courses, you know, in a group setting, and any sense of community was not there. So that was from the get-go something that I kind of accepted, and that was kind of the way that it was. It didn't, I just had radical acceptance about that. But then as I went further along and I realized that women were actually having these abuses happen to them and their newborns when they were giving birth in a hospital setting and in a midwife setting, actually, that this was something that was extremely scary for me. And I started to experience more stress about the whole situation. And everything was compounded, you know, by being also a first-time mom and not knowing what it's going to actually feel like, what it's going to be like, what are the normal circumstances, and then having to look at that on top of that and feel like I have to go into a fight mode rather than into a kind of learning mode where I can just read books, where I can take courses, where I can prepare myself emotionally, physically for the birth. I've had to just spend a lot of energy pushing back and building a kind of armor against institutionalized abuses that are happening.
When you first published your essay titled again Obstetrical Violence, what were the main factors, a main story that stood out to you that you took a step back and said, whoa, this isn't okay?
Yeah. Well, there was a story of a woman who was in New York City during Governor Cuomo's ban on having a support person. Now we know that you can have one support person. Toronto did the same thing. You weren't allowed to have a support person for a short period of time during the pandemic. But that didn't concern me as much personally, because I knew at this point I would have one support person, even though I would rather have more, of course. But one thing that I found extremely concerning was the dogmatic approach to laboring women who have no symptoms wearing masks in labor during obviously what's the most extraneous activity that you'll ever do in your life, where all you learn about as you're growing up is, oh, you're going to have to know how to breathe when you give birth. It's the most basic thing ever. And then that these, so I ended up finding a group of women in France who had actually taken down all of their stories and fought back against the government. And the Ministry of Health in France actually made a statement. They were put into a corner and they had to finally say, we cannot implore laboring women to wear masks. It's not okay. And their experience has to be a privileged experience. It can't just be something that is dehumanizing psychologically, that is making it difficult physically. And there was an association with these women. What they were finding was that they were experiencing depression, postpartum depression, and physical issues. Actually, they were needing to have interventional C-sections. They were needing to have induction. They were needing to have their babies removed by forceps, and they weren't able to breathe. And they were threatened that if they kept their masks off, that they wouldn't be given treatment.
So withholding medical care based on a mask policy that, as you're finding, doesn't seem to have a lot of basis to back up the justification for these claims. Now, off camera, we discussed pretty in depth the various policies that are at play here, and especially at the local hospital that you've chosen to give birth. They state off the record, so no one is willing to put anything into writing regarding the masking of laboring women, but they stated verbally that you would wear your mask until the hard part.
Yes.
And were you able to confirm what that meant or how that is defined?
No, not really. That was what I was told in my initial phone call to the hospital maternity ward, that you'll be wearing your mask, but you can take it off during the hard part. Don't worry about it. And then we'll have you put it back on as soon as the baby's born. So they're interrupting the bonding process. The most important moments of life are you're being dehumanized, and your infant is being dehumanized as well. And
that's prompted you to write a set of emails and questions to various levels of this health bureaucracy. So starting with your OBGYN, your hospital, and now it's gone higher up to even the Ministry of Health, the Ontario Ministry of Health. Things like, that masks on healthy laboring women are necessary to protect healthcare staff. That there are no ill effects, like you spoke of with the women in France, that there are no ill effects, added stress, or difficulties with labor and or harms caused to mothers because of the mask policy. That, socially distancing newborns from their mothers will not cause more harm than perceived benefit. That's in the Ontario Ministry of Health policy, that if you're a woman who's suspected or confirmed COVID-19, that you'll be separated with a physical barrier from your newborn unless you're nursing them. And even then, that's discriminatory among hospitals.
and you'll be masked. You'll have to wash yourself. The baby will have to be washed. It's like this whole sanitization process, this separation of mothers and their newborns. And then there's, of course, the famous swab that now they're saying we're going to test newborn babies within 24 hours. If you give birth and you've tested positive or you're suspected positive for COVID-19, then we will take your little baby just born and stick a swab up their nose. And on top of this, I've sent in all of my emails and all of my phone calls that I've managed to reach my MPP, for example, I've stated that there's a study that shows, actually, it came out, I believe it's in December 2020, that said they took 3 control groups. So they had 63 women who tested negative for COVID-19, 64 women who were positive for COVID-19 with various symptoms as well. And then there was a control group of 11 women who were not pregnant even. And so they wanted to see if there was transmission between the mothers in their late term of pregnancy and their newborns. And there was a 0% transmission. And so I've brought this study up and I've said, these are the kind of studies that I'm finding. Where is your scientific evidence for your policies? Mm-hmm. Can you please provide me with scientific evidence that, first of all, the type of mask or any type of mask at all in general is doing anything to protect you from me as somebody who's not sick? And second of all, that while I'm laboring, that a mask is not harming me, that your policy is balanced in consideration that I should not be having to wear this mask because it's been proven now, it's been linked to birth defects even.
Mm-hmm. And poor outcomes for both the mother and the baby.
There was a baby born with amniotic fluid in the lungs, and with a disformed head because they needed to use forceps to pull the baby out because this woman was wearing her mask the whole time. They wouldn't let her take it off. And all of these kinds of abuses are happening and no one will answer to it. No one will give me any scientific data.
Mm-hmm. Well, and here, like I was saying, you've outlined very clearly a request for information, various requests. Mm-hmm. And one of the 2 very important things that I've found in these questions, you ask for the peer-reviewed data or the evidence-based data that asymptomatic spread of COVID-19 exists. Mm-hmm. That right there is a pretty, big factor to consider in all of these policies and protocols. Yeah. And then the second last question, proof that your policies are made and implemented with a balanced, rational approach, which do not disproportionately favor the real or imagined protection of healthcare workers over the health and well-being of the mother and infant.
Yeah.
That is the forefront of ethics, is weighing that risk versus the benefit. And you've outlined very clearly requests for information. You've supplied your own data and research and asked, can you either confirm or deny what I've found and cross-reference it with what you've provided here. Now, the other key point that I wanted to just go back to quickly was those, and any mother and any father, any family can attest to those first few hours after a baby's birth where, they're looking at your face, you're looking at their face, that bonding that has been studied, tested, proven as key factors in the development of a neonate.
Yeah.
And the bonding with their primary care providers. To mask women and implement a mask policy of women while they're breastfeeding their newborn, how can anyone state that the benefit of that outweighs the long-term risk psychologically for both the mother and child?
Right. That's the, have you ever seen the still face experiment, for example? Mm-hmm. Right. It's an attachment study. So they actually had a woman, come in with her infant and they would ask the woman to stop reacting to the infant. And when the infant didn't have any facial cues from the mother, he started to go into a state of distress. And this is what's happening here as well with this. But that's in the first moments of life, even the most precious times. Apparently a newborn can only see like 8 inches in front of it. It can see your face. And that's the most important thing for a newborn to see. Like, how can they be dehumanizing this experience the very first experience of life. It's deplorable and it's abusive. And the fact that nobody will take responsibility or accountability for it or answer any questions about it, and that they're completely dogmatic about it, but they don't know why. They're just doing it. That just tells me it's not scientific. It has nothing to do with any peer-reviewed evidence. It has nothing to do with anything that's been studied. It's a knee-jerk reaction. It's fear-based. And they know that it's harming people. They know that it's abusing people. You know, I've actually had a lot of women reach out to me since I wrote my article, and they've shared their stories, and they've written to Christine Elliott, and they've written to the Ministry of Health, and they've said, this has been my experience. One woman, for example, she had a very traumatic birth experience with all of the compounding effects that we've been discussing here today. And on top of that, she was told to bring in her 3-day-old daughter into the hospital to have just a regular checkup because she had lost 10% of her birth weight. And when she got there, she was actually bombarded with ideas that we're going to test your baby for COVID-19. This is not even anywhere in the protocol, by the way. So they're also using this protocol as a very vague document to say, you know, do something like this. It's being interpreted different ways everywhere, which we know that they're aware of. And so then anyways, they took her baby and said, okay, we're going to test her for COVID-19. She's lost 10% of her birth weight, 3-day-old baby. And the woman said, no, if anything, you can test me, but you're not testing my baby. She said no. And she heard her baby screaming 2 seconds later, and they were swabbing her up the nose. Now the baby is 5 months old and has problems breathing. This woman followed up. She followed up, made a complaint, and they just said, well, deal with it with the hospital, you know, and this is what I've been experiencing as well. I'm just being shuffled around. Nobody's willing to deal with me. Nobody's willing to answer my questions. Everybody's trying to isolate me and say, okay, well, you know, for you, we'll maybe do this or that. We'll be more lenient here, but not here. Listen, I don't want to be wearing a mask during any part of it. I don't want my husband to be wearing a mask during any part of it. It's as important for me to see his face while I'm experiencing this, and for him to see my face, and for that bonding to take place, releasing oxytocin so that I'm able to labor properly even. It's more than just emotional. It's spiritual, it's physical. It's all part of the labor process. And they are infringing upon that sacred process with non-scientific policies
that are clearly causing trauma to mother and baby and the support person.
Yes.
Do you have a message, Kate, for your OBGYN, for the hospital, the elected officials? What's your message? What do you want to see happen based off of your research and the information that you're requesting?
I would like for them to think about the fact that in many instances in history, the medical professionals were the first people to jump on board in terms of tyrannical types of experiments, and that a system that has no accountability is the perfect recipe for institutionalized abuse. If the Ministry of Health is not accountable, if the medical staff is not accountable because they're just following what the hospital says, if the hospital says, well, we're just following what the ministry says, if the ministry says, well, the hospitals can do what they want, we just give them suggestions, and nobody's actually listening to the women who are experiencing this, and nobody's actually caring about the long-term effects of swabbing a baby for absolutely no reason when we know that there's zero transmission. When they justify abuse in the name of science without actually citing science, then there is an institutional problem there, and that will not go away until it changes at the institutional level. And so my message is, change your policies, because I will not stop until you do. And other women are behind this as well. And one day, when this whole COVID thing is over, people will be responsible for their actions individually and institutionally. So it's best to proceed wisely.
Appreciate those sentiments. Thank you, Kate. And I have also reached out to the media contact for the Ministry of Health, Christine Elliott, the local elected officials, the local health unit, and the local hospital. So if there is an update to provide with any of those responses, then please follow along because I will be doing that at a later date. For Rebel News, I'm Tamara Ugolini.
Don't forget to like, share, and subscribe to the Rebel News channel so you can stay up to date with our stories as they break. Here at Rebel News, we're putting out more content and showing the other side of the story more than ever before that you don't want to miss. In order to receive premium Rebel content, please consider subscribing to Rebel News Plus at rebelnewsplus.com.